Good afternoon. Welcome to the daily briefing in St. Clair County here at the EMA office, where we're joined once again with Chairman Mark Kern and, of course, Sam Bierman from the Health Department. It's been a long day, but Sam, it's Monday.
It is Monday.
And we want to just thank all the followers yesterday who had all those great questions. I think we answered a lot of them, and people seem to be okay with them.
I know every Sunday we come in and we're excited to see what questions they have, and they put us to the test yesterday. So
yesterday was a test.
It was. So as of today, we have tested 4,903 St. Clair County residents with a total of 892 positive test results, which is an increase of 17 from yesterday, and that includes both males and females from under the age of 10 up to their 90s. We are currently at 3,991 negative test results, with 20 results still pending. And we do have some sad news to announce today. We are going to be reporting one additional death. So that does bring the total up to 69. And that individual was a male in his 80s with unknown health conditions. And as always, our sympathies go out to that family. For individuals who have completed their required 14-day IDPH quarantine, we are at 482. And for state totals, we are at 603,241 that have been tested, with 96,485 positive test results, which is an increase of 2,294 from yesterday. And for deaths, we are at 4,234, which is an increase of 57 from yesterday. Hospitalization numbers, and these are for hospitals that are in St. Clair County. Currently, we have 52 patients that are admitted due to COVID-related reasons, and 2 of them are on ventilators. For congregate living facilities in outbreak status, and that means 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Berea of Belleville has 23 cases and 2 deaths. Berea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 7 cases and no deaths. Colonnade Senior Living in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 105 cases and 17 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville currently has 6 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 10 cases and 3 deaths. Swansea Rehab and Care Center has 4 cases and no deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And before we started the briefing today, someone had brought up the question, if someone were to be hospitalized in a St. Louis hospital and they were to pass away, would they be reported with St. Clair County numbers if they resided in St. Clair County? And the answer is yes, if that information is reported to us. We have moved far down the road as far as opening up the channels of communication with St. Louis hospitals, and so we have a much better line of communication now. So yes, if they did pass away in St. Louis or at a St. Louis hospital and they did live in St. Clair County and it was reported to us, they absolutely would be included in our numbers. And I will turn it over to Chairman Kern for his updates.
Great, Sam. And real quick, so last night after we were finished, I received a question from a viewer about how nursing home numbers are treated and intermingled with our zip code reports. Can you talk about that and how we define nursing homes within the zip code connotation?
Sure. So for when we do long-term care nursing home and congregate living, that's a group home, when we report those numbers in the zip codes, the zip code numbers include specifically people that have been tested and are COVID positive. When we are looking at the congregate living and nursing home numbers, those are people that have been tested and or that are confirmed, or they have symptoms. As we had said, you have to have 2 or more to become considered outbreak status. And in that situation, if a staff member that works at a long-term care facility is positive, but they might live in another county, they would be reported in that county's numbers.
Or in another zip code.
Or in another zip code, correct, depending on what the situation may be.
So because the long-term care facilities don't break out the difference between how many residents and how many employees
Correct.
have COVID. Really, the zip code reports are the zip code reports because we can't really break out nursing homes because we don't know how many are residents and how many are
Correct.
employees.
When we get those results, we get them as a lump number. So,
Okay, well, and we'll continue to try to drill down on numbers, but for now, that's how we're receiving the numbers from the long-term care facility.
yes.
So, thank you, Sam,
Absolutely.
for all your work. Sam puts those numbers together every day. She's working long after this is over and well into the early morning hours to try to get these numbers ready for us for today. And she's working right up until we do the show, simply because we want to give you the most updated numbers that we possibly can. So we've had numbers come in within 5 minutes of when we do this, and we add them in because that's why you're here. That's what you wanna hear about. So today we'll do the zip code reports. Remember, in these zip codes, if you don't hear your St. Clair County zip code, it isn't because you have no COVID positives in your zip code. It just means because we haven't risen to the level above 5 in your zip code yet. 62201, we remain today at 13. 62203, we remain at 28. And 62204, we're now at 34. That's an increase of 1. 62205, we're now at 42. That's an increase of 1. 62206, we're now at 78. That's an increase of 2. 62207, we remain at 55. 62208, we're now at 49. That's an increase of 1. 62220, we're now at 94. That's the same as it was yesterday. 62221, we have 77. That's an increase of 1. 62223, we have 44. That's an increase of 1. 62226, we have 110. That number remains the same. 62232, we now have 15. That's an increase of 1. 62239 remains the same at 11. 62254 remains the same at 26. 62257 also remains the same at 8. 62258 remains the same at 14. 62269 remains the same at 61. And 62285 remains the same at 7. I also would like to alert everybody that this is EMS week, so make sure that you are out there. You see your local EMS workers or anyone who's working emergency services. Make sure that you thank them and give them a lot of credit for what they're doing, especially during these tough times when all these extra precautions are being taken and all the extra dangers are out there. We really appreciate all the jobs that they're doing. So thank you. And Herb, what you got?
Thank you, Chairman. Sam, on your ages, you mentioned that one of them was a child.
Yes.
I know the other day we had reported on like a 16-month-old, but this is actually how old? Do you remember?
I don't want to get specifics, but is it
Right.
this under 1 year old?
Okay.
Under
So
1
again,
year old.
the point being that, as we started this several months ago now, a couple of months ago, it was believed that it was only affecting the elderly, people over 65 years of age, and I think that's been proven now that there's no age limit to where this thing goes.
You're
So,
absolutely right. There is not.
Yeah. And so just, one death over the last 24 hours here in St. Clair County. As we say all the time, one is too many, but, our condolences go out. So we had a long day yesterday getting those answers to you. We appreciate you following the briefings. We hope you find them beneficial. As we say every day, we know that everybody is stressed out. Everybody's wanting to get back to normal, whatever that's going to be. Nobody better than all of us sitting here wish the same thing. So we'll be back tomorrow afternoon at approximately 3:30 for the next briefing. We'll be back with Cindy and Daisy, or I think we only got Daisy today, to translate it into the Spanish community. So we'll see you tomorrow. Thank you.